Good morning, everyone. Good day, depending on where you are joining us from. Welcome to today's Oraposium. This is Oraposium 35. Today we have a very wonderful presentation from one of our very own. And in 3 minutes' time, we shall begin the presentation. So I would like you to invite your friends and colleagues who are not yet here with us to join us in today's presentation, because as usual, it's going to be interesting, educative, and informative. In fact, today's presentation is also going to be very, very entertaining. So sit tight while we wait for others to join us. And for those who are joining us for the first time, we welcome you to the Orapo community. The Orapo community is available on all social media networks. You can find us on Facebook, on Twitter, Instagram, LinkedIn, and a whole lot of others. So while we wait for others to join today's presentation, I would like to introduce our presenter for today. But first, let me introduce myself. I'm Chukwuemeka Nnaji. I'll be the moderator for today. I'm a registered dental therapist. So today, we have a very wonderful and distinguished presenter. Our presenter is Orji Ogechukwu Roslyn. Orji Ogechukwu Roslyn is a dental technologist. She's also an oral and public health scientist and promoter. She earned a mini master of dental public health. She earned a mini master of dental public health from Orapo schools, and she's also a member of Orapo College of Scholars. At the moment, Roslyn is CEO of Roselle Smile Dental Lab in Oba, Anambra State, which is actually the very first dental facility in the history of that town. Rosary Smile Dental Lab specializes in restorative treatment to help restore the smile, function, and confidence of people. In today's presentation, Ms. Rosary will be presenting communication methods in oral health promotion. Communication methods in oral health promotion. So without further ado, I'd like to welcome the presenter to proceed with her presentation. Thank you. Rosemary, you may go ahead and begin your presentation.
Okay, thank you so much. Good morning, everybody. Hope we are all good.
Good,
Okay.
thank you.
Yeah. Yeah, I'll be the one am I the one to project the work? Let me know. Or
Just
you
go
would help
ahead.
me.
I will do that.
Okay. Okay. The topic I'll be presenting today says communication methods in oral health promotion. Here is the presentation outline. Introduction. Communication in oral health promotion. Aims of communication in oral health promotion. Types
I don't know if it's from my end, but I can't hear you, the presenter.
Hello, Miss Ogechukwu, are you still with us? I'm sorry for the break in transmission. I think we are having a poor network connection. The presenter is no longer with us. I hope she joins us shortly. So while we wait for her to join us to complete her presentation, I'd like to welcome those who are just joining us to today's presentation. This is Oraposium 35. Today's presentation is titled Communication Methods in Oral Health Promotion. The presentation is being made by Orji Ogechukwu Roslyn, a dental technologist and the CEO, Rosary Dental Lab, Oba, Anambra State. So she'll be joining us in a jiffy. I guess our connection is having serious network problem. So while we wait for her to join to complete the presentation which she just started, I'd like to invite you to add your friends to join us, your colleagues, in this wonderful presentation of today, because there will be a lot of interesting lessons, many take-home tips to improve your practice and your professional knowledge. Thank you. We are still trying to get Ogechukwu to join us. Please be patient with us. The network is really bad where she is joining us from.
Okay. Good morning, moderator. Maybe you should project the presentation. Let's see if our director can help us out with the presentation until she comes back so that we don't keep our people waiting. Thank you.
All right, thank you. I'll just do that. So, based on the suggestion raised by the lead mentor, I would like to invite the director of the Oral Health Division, Aroa Samuel Oko, to please continue with the presentation, pending when Ogechukwu will join us to finish it up. Thank you. Mr. Samuel, please, are you with us? Are you ready? Mr. Aroa Samuel, please, are you there with us?
This is not available. Maybe he's seeing a patient. I don't know. The director of the Division of Public Health, can you attempt that?
I'm currently on transit to work. I don't know if I will be clear enough to take the presentation, but if you can hear me, please let me know.
Please go ahead. Your side is very clear. We can hear what you are saying. You may go ahead and continue with the presentation. Yes, please go ahead.
Moderator, please project the presentation for. Okay, Ogechukwu is back.
Hello.
Hello, Ogechukwu.
Is anybody hearing me?
We lost you. Yes, we can hear you. We lost you. We've been trying to get you online. Thank God you are back. Please, you may go ahead and continue with the presentation.
Sorry about that. I just noticed it's network. Sorry. I'm talking on aims of communication in oral health. Was that where you lost me? Hello?
So you start from the beginning. A whole lot of the things you said, we didn't catch it.
Okay. It's network. I'm sorry about that.
No, it's okay. We understand.
Okay. Let me start from communication in oral health promotion. Communication is the process by which two or more people exchange ideas, data, passions, or prints. Prints is a writing, form of writing, paper writing, so that each person gain a common or collective understanding of the meaning and the use of the message. For communication to be effective, two or more people must be involved: the sender and the receiver. The sender should be able to make the other party or The sender should be able to make the receiver to clearly understand the message he or she is trying to send across. You don't necessarily use ambiguous words in order to do that. You don't have to. So the receiver must be able to decode the information that the sender is trying to pass through in order to be able to send a feedback to this sender. This feedback may be in an affirmatory word like, yes, I agree with what you are saying. Or the receiver may say, no, I disagree with what you are saying. So now when he or she sends this feedback to the sender will know where to make adjustments so that both the sender and the receiver will gain a common understanding of what is being talked about. So please, I'm on Ames. The slide. Okay, thank you. So the aims of communication in oral health promotion. Number 1, increases knowledge and mindfulness of an oral health issue, problem, or its solution. One of the aims of communication in oral health promotion is to increase knowledge, because an oral health care professional has been trained in this aspect. He or she now goes about to transfer that information that he or she has about a particular, let's say a particular oral condition or disease that is affecting the people. Take for instance, dental caries. He wants to educate them on what can be done in order to stop or bring to minimum the spread or the prevalence of this dental case. And then on the aspects of the receiver, which can be the patient or a population of people or an organization, they will gain this knowledge and then become aware of what is leading to this dental issue. When they now become aware and then make a positive change towards acting to bring it down to a minimum, then oral health will be promoted. I once had an incident where I came in contact with a patient. He was having a small growth at the back of his last molar. When I saw it, I told him, yeah, you need to visit a teaching hospital for them to really look into this case, because I can't handle it. I'm not a specialty of that. He neglected that advice I gave him. That advice was 2 years ago. He neglected it. So now his mouth, that growth has become so big that on a daily it is increasing. It is increasing. So it is because this patient is not aware that this thing he is having can lead to something disastrous. That was why he neglected it. But even when I talked to him, that I made him to become aware that this growth you are having can lead to something else in the near future, that you need to act upon this, he equally neglected it. So it was when I now put him, I was the one now taking him to that hospital and everything, that he now was like, oh, I shouldn't have neglected this when you told me to. So when communication is effective, it is aimed that oral health will be promoted when a person or an individual gains knowledge and mindfulness, and even solution to his or her oral health problem. It influences beliefs and social morals about oral health. Yeah, some persons have lived with this belief that if I extract one of the tooth in my mouth, it will affect all other tooth that I will on a constant basis be extracting my tooth, without knowing that it is his oral health, that is poor oral hygiene practices, that can affect that. So the aim of communication, when this kind of patient or a person or an individual that has believed that this my oral condition, that if I remove one tooth, I will remove another, I will remove another. When you communicate in a clearer terms, to this patient or to this person that no, it won't. When you remove one, it will lead to you removing another, except you don't practice good oral hygiene. I believe that oral health will be promoted. Also, it generates effective action. This action comes in the part of the receiver, being the patient or the population or community organization you are, as a dental professional you are talking to. When they swing into action, like this person has known that yes, when I do not practice poor oral hygiene, when I do not practice a good oral hygiene, it will lead me to having my tooth extracted. It will lead to dental cavity. It will lead to some oral diseases. When he or she now plunge into action by practicing good oral hygiene, like say you have to brush morning and night, he or she does it. You have to make use of dental floss. After each meal, try to rinse your mouth with water. Use fluoridated toothpaste. When he or she imbibes all of these, oral health of that patient or that individual or that group of persons will be effectively promoted. It demonstrates or illustrates oral health related skills. This is in the aspect of the dental professional. Yes, when he or she must have found out what the oral health problem of this patient is, he or she will now swing into action in order to avoid further occurrence of that issue that the person is having. It shows the benefit of behavioral change. The behavior of the patient will be modified as he or she try to adapt to the new change or to the new oral hygiene practices that he or she is meant to undertake. It increases appropriate use and demand for oral health services. When a patient or an individual is effectively communicated that once you have any dental related issue, that where you must visit is a dental facility. Do not go to the pharmacy, do not go to the chemist shop, do not go to all these local places that you take herbs and everything. When he or she does that, and seek a solution to his oral health problem in the designated facility, which is a dental facility, oral health will be promoted. Also, it reinforces knowledge, attitudes, and behavior. Next slide, please. Types of communication in oral health promotion. Oral or verbal communication. In oral communication, speech or talk is the extensively espoused tool of communication. It is communication by word of mouth and may also be achieved through telephone, radio, or a public address system. Oral communication is by word. Don't necessarily need to write anything down. You tell the patient one-on-one. Let's say, for example, when a patient undergoes extraction, the oral health tips that will be given to the patient: do salt and warm water, don't take alcohol, do this. You tend to say it verbally. I could recall when I established this my dental facility, I employed the services of these public address personnel that I had to give them some of the flyers, pay them, like let them go into town, distribute these flyers to people. This is an oral communication. So when a person now gets such flyer and read what is now written on it, he or she will gain a knowledge of what is being talked about. Then written communication. Written communication involves the exchange of opinions, data, and ideas through the use of scripts or papers. Individuals or groups keep in touch with each other and share meaning and understanding with each other through written scripts or paper, which could be letters, notes, circulars, reports, handouts, bulletins, or journals. Next slide. Non-verbal communication. Non-verbal communication is achieved through the use of one's body rather than speech or writing. It can be called body language. It is worth noting that body language may indicate a different meaning to what is spoken. Take, for instance, when a patient visits a dental facility, like you want him or her to face you face to face, you may not necessarily tell the patient, face me, face me. You can use your hand to change the sitting position of that patient in order that that patient will face you. Or you want to lift the head of that patient. Maybe you want to take a dental impression of the patient. You can use your hand to raise the head of that patient and then and then take the impression of that patient. So this is a form of unwritten non-verbal communication by use of body language. Communication methods in oral health promotion. Number one, picnic or local outreach. A dental team might decide to organize a picnic for the people that they tend to gain some information from, and also communicate what their oral health needs can be in order to give them solutions to that oral health problems that they are facing. They might decide to come into a small community and then gather little children. Yes, you might start from dishing out food. Maybe you made a little food in takeaway, you can give them. These children, out of excitement and happiness, will gather other children for you. You don't even need to start going into community telling children, come. Because you've given one person food, the other one person will call another. Before you know, everywhere will be filled with children. Maybe the information you want to gather is as regards the oral health of children. Let's say between the ages of 6 to 15 or to 13. By giving them this food, making them happy, they will feel safe with you and then be able to sit down and disclose any information you want to gather from them. And then local outreach. This is equally a form of local outreaches because it's basically done in communities that lack this oral health knowledge and information. When you give them this and they're eating, you'll be like, oh, how many times do you brush in a day? That one will tell you, I brush once. So no, I don't know what toothbrush is all about though. What do you make use of toothbrush? No, I don't. This person will say, I do. So with those informations you are gathering from these kids, you'll be able to write something down in order that when you now go back, you will now have to draw a plan, which will be a treatment plan in order to meet the oral health problems of these kids. By so doing, the oral health of those people in that community will be promoted. Also, use of questionnaires, a well-structured questionnaire, which can be either a closed-ended or open-ended, can be structured in order to get meaningful information. Let's say you want to talk on the prevalence of dental caries in a particular community, or from an organization want to get the high rate of the prevalence rate of dental caries. You go about sharing a well-structured questionnaire to them, when they must have read and filled out their options. You take it back and then do your assessment and then come with a conclusion. Seminar presentation. A seminar is a conference or meetings for discussions or trainings. Yes, and open, you might decide as dental team, maybe NGOs, non-governmental organizations, you may decide for them to sponsor you people, that is this oral health care team, in order to conduct a conference for people in a particular community, that you want to gain access or understanding of what their oral health need might be. This will help to get meaningful information from them. When you now act on what you have gathered, you can be able to profess solutions, and then the oral health needs of those people will be met, in which oral health will be promoted. Traditional media or non-media, you might print flyers, posters, and then share to people. This Jehovah Witness people, they do this a lot. If they come to your house and they want to preach to you, maybe you are cooking or doing something, you'll be like, no, I'm doing something. I can't be listening while I'm cooking to you people. They will say, okay, don't worry. Oh, in your leisure, go through this handbills or flyer that will be given you. You say, okay, they will leave it with you and they go. So when such a thing is imbibed, this non-media traditional use of flyers and poster, when you use it to disseminate information, maybe on that flyer you printed brush 2 times daily, morning and night, use fluoride toothbrush, do stop playing roughly for children, do not use your teeth as a bottle opener. When you write all these things down and disseminate it to people, to individuals, I believe when the person goes through it, he or she, that would the read up, when he or she starts practicing it, it will help to promote their oral health. Then video-based communication. This involves the use of materials and pictures and dynamic photos and videos or even animations to promote oral health. This involves promotion of oral health using multimedia video as an effective tool to establish a good oral hygiene routine. Many people imbibe this. I might decide, I've even done this one time where I was educating people on the need for a dental restoration. How to show different types of dental restoration and need for you to think of replacing one or two of your missing tooth in the oral cavity, you can make a short video clip and then put it out there in the social media. When someone comes across it and read it, he will gain insight, meaning from it, and this will also affect their oral health habits positively, in order that oral health will be promoted. Use of electronic applications. Various applications have been used for oral health promotional activities. We have one that said My Dentist. One of the app, My Dentist, is an app. Equally, Tooth Saver, it's an app also. They are used as tips for you to gain better oral hygiene procedures. Even also, you set a reminder. Let's say you have a dental appointment. You are this type of person that don't really remember. You set, because you have this app, you go on and click and set a reminder that, yes, so date, I'll be meeting with my dentist for an oral health checkup. It is equally used to track oral health behaviors and also oral health educational content. Then digital media and social media. We are now in a computerized era, 21st century. Even a 5-year-old child now has a phone. So as an oral health care provider and promoter, you may decide to make use of these different social media platforms to preach your, like, call it dental good news or oral health good news. Yes. So that when someone comes across it, be it an individual, an organization, a group of people, they will be able to gain knowledge from such message you have sent across. It's because of digital media today that I'm giving this presentation. Telegram, it's here for me to as I'm talking, it's as if I'm one-on-one with each and every one of us. But is this social media, Telegram, that brought us together in that line. I follow one lady. She's a dental therapist on social media. Lisbeth Dental Care. She does great. YouTube channels, Telegram links everywhere. She dishes out informative advice that will help in the promotion of oral health of individuals when they imbibe such. So if we put into action any of these communication methods, I believe it will help to spread the dental good news to all and sundry, and then to help in promotion of their oral health. Next slide. Hindrances to communication in oral health. Yes, even as these methods seem seamless, not so difficult to do, there are some encounter one will gain on the way, which might be a hindrance to this effective communication, so that oral health will be promoted. And one of these hindrances is language barrier. Let's take, for instance, a patient visits you, and the patient is an Hausa person that doesn't understand the English or speak English. When he or she visits, you are trying to gain information of his oral health need, like, why are you here? What is your dental issue? What? And you will now say, either I speak Hausa for you that you don't understand. This will be a barrier because you don't know where to start in order to give solution to these patients. Or in a community you came, they only speak Igbo. That you, as a oral healthcare provider or as a team that went into that community, you don't understand Igbo. You speak English and your other native language, which might be Yoruba. It is an impediment for you to deliver successfully or to meet to the oral health needs of these people, because there is a barrier in language, cultural differences. This equally is a hindrance to communication. Say, for instance, you enter a community whereby the men or boys in that community believe that it is only boys that can attend to their oral health needs and only women can attend to women. Where in a case where it was only women that went into that community to deliver, you would see that the oral health need of the men cannot be met because there is no how the women will start attending to the men, because they have this perception and this belief that no, women do not touch or treat issues regarding to men and vice versa. This is a hindrance to communication in oral health promotion. Conflict. When two or more people are not sharing common ground, when they are not agreeing to terms, this will be a hindrance to promotion of oral health. Mental or emotional distress. When a patient is filled with fear or anxiety, I think he or she will not be able to effectively say what is wrong with him or her, so that it will aid the oral health care provider to know what can be done for this patient. So mental and emotional distress is one of the hindrances. Speech and hearing difficulty. You know, some people that may have, let's say a patient may have involved in a ghastly accident, that the whole anterior, either up or down, had fallen, anterior teeth had fallen. You know, speech is impaired. And when he or she is trying to say what really caused this accident or how it all happened, he will be straining himself to talk. And in his own end, he will be encountering some difficulties in speech. Equally, in the aspect of the oral health care provider, he'll be straining his ear to get vital information from this patient, because it is from getting this vital information that will give him or her the strength to start acting in order to meet to the needs of this patient. So I believe speech and hearing difficulty can hinder communication in oral health promotion. Medication. Oftentimes, patients or a person that is going through a dental pain, maybe this person is having toothache, they tend to take different medications. And this different medication likely worsens their case. Yes, it has a significant effect on these patients. It may cause them dry mouth. It may even cause excessive salivation on the part of these patients, or it may cause them to start vomiting and this will affect their ability and their motivation to engage in discussion with the dental provider. So this is a hindrance. That is why it will be very good that when you are going through severe dental ache or having a tooth decay, go to the dentist, let him or her profess solution so that your case will not be worsened. Rather, it will be brought to a significant state that you will be good. Yes, you will receive your total healing and then be good. The last but not the least is environmental pollution. This environmental pollution, or let's call it noise, can come from where the dental establishment is being is. Let's say you cited your dental facility in all these commercial places where everybody put on their gen. There is noise everywhere, or near a marketplace. If a patient comes, it will hinder communication because everywhere is so noisy, so rowdy. Even some of the machines we use inside the dental facility, it tends to generate noise equally. And this can hinder communication because the patient can't be hearing what you are saying, and you on your own can't be hearing what the patient is saying very well. It is a hindrance to communication in oral health promotion. In conclusion, oral health is one of the most important public health priorities in the world, and hence, effective oral health promotion is paramount. Given the importance of oral health in the whole body and the high prevalence of oral diseases, the joint efforts of dentists and clinicians, oral health professionals, individuals, parents, organizations are essential to communicate healthy lifestyles to the people, and it should be integrated as a part of the comprehensive oral health promotion. Lastly, here are my references. Thank you, and God bless you for listening.
Wow, what a wonderful presentation from Rosalind Ogechukwu. Thank you so much for that brilliant and detailed presentation. You did justice to the topic. You communicated effectively. And I am sure that all of us who have been present in this presentation have gained a lot. So now it's time for questions, clarifications. If you have any question you would like to ask the presenter, this is the time to bring it in. Please note that this paper has undergone scrutiny and correction, so no corrections will be entertained here. However, if you have any additional points to add, or you have questions to ask, or you need clarifications, please, the floor is open. You may drop your comments. You may also speak.
Okay. Good morning, everyone. Good morning.
Morning.
Good morning, our presenter, Ms. Ogechukwu, Rosalind. It's nice listening to you. It was a wonderful one, and I really commend your effort you tried. First off, I want to start with an apology. I heard when you called me, Mr. Moderator, that I was unable to speak. So that's why I want to speak quickly so that I can actually return to work. Okay, I'm so sorry, please. All right. Um, the topic, communication methods in oral health promotion, um, is an important one, is an interesting topic. I see that methods as strategies. I see it as strategies, and the truth is, you can't talk about care, oral health care, even general health care, without talking about communication. I have found out that when you're talking about care, you cannot rule out communication. So communication is one of the ways to administer oral health care or even general health care to the people who needs it. Recently, I saw a patient who came to the clinic having this perception that, okay, two of them, that they had mouth odor. So they paid for S&P, they paid for tongue scraping and some other things they paid for, and bought some products as well. So when they came in, based on my engagement with them, my communication with them, what I told them, the instructions and little education I gave them, they were already satisfied, and they understood that the mouth odor they think they had was just a perception, psychological. They never had mouth odor. So that communication, because I was able to communicate effectively to them, they got satisfied even without receiving that tongue scraping. At that point, I had not given the tongue scraping. I've not done S&P for them, but they were already satisfied. So that's why communication is very important, and it should be done per person as well. The method, that's why I like this topic very well. The method, communicate, is not just the communication, but the methods as well. So different persons, you adopt different methods for communicating with them. Otherwise, your communication may not be effective. You can't communicate the same way you communicated with someone who can talk and hear, to another person who cannot hear and talk. So different ways, you can't sometimes you can even have a different way of communicating with people, with man and a woman, different with different community, like Ogechukwu rightly said. In a community where you can't understand, maybe they can't understand your language as well, you communicate differently. Different methods, very important. So for you to effectively deliver care, you communication is very important. To achieve an effective care, you must know how to communicate effectively and know the methods per person. It is very important. The methods per person is very important. That's my take-home lesson from this presentation. Thank you, Mr. Moderator. Thank you, our presenter. Thank you, everyone.
All right. Thank you so much for your wonderful contribution. Thank you for deepening our conversation, for enriching the presentation. We have some comments here from Sabuda Steven. Sabuda Steven says, thank you, Ma, for this great presentation. Sabuda, thank you too. So I have something to ask, please, the presenter. When you were talking about barriers to or hindrances to communication or to effective oral health communication, you talked about speech and hearing impediments. And Mr. Samuel also mentioned it while he was talking. So I would like to ask, supposing as a dental professional, I want to communicate people who are who have challenges with speech. They are deaf and they are dumb and they can't hear or speak. And I want to communicate to them because this particular set of people, I believe, are underserved and they are the margins of society. And part of our training in schools do not include sign language. So how can we reach such population? Because people like that, usually their oral health needs is severely affected and neglected. So how can we reach out to this? How do we communicate with this set of population effectively?
Okay, thank you for that question. I believe there are people that are trained in sign languages, as you made mention of. So in the aspect of these oral healthcare professionals, I believe they can sort their expertise. That is hire one or two persons that is trained in sign languages. When that is the person trained in sign language, now another person that will now interpret to you as the dental health provider, because I believe, like someone like me, I don't understand sign language, but I know I understand English. So now, when I pass message to the person that understands English, the person that understands English will pass information to the person that uses that sign language, and then that person that uses sign language will now pass information. We relay the information to those people that are having those hearing impediments or speech impediments. So when this information is now transmitted in this way, I believe at the end that's an information that will help me to act, that I can act upon to get to the oral health needs of those people can be met. All it will entail is to hire these people, which I know will require money. So I'll have to put it at the back of my mind from the onset that fund is necessary. I need to put all these people in place so that what I hope to achieve, the goal, will be gotten, and then oral health needs of those people will be effectively met. Thank you.
Thank you so much for those brilliant answers and solutions to the problem. We have another comment from Nnamdi Bright. Nnamdi says, "Thank you, Ogechukwu, for this wonderful presentation. I really learned a lot. Meanwhile, I have two questions. One, which is most effective communication method? Two, language barrier. Is there no solution for it? I would like you to respond to this question very briefly so that we can end the presentation for today. Our network took a lot of time. So please go ahead and respond to the question. Hello, Mr.
Hello.
Ogechukwu, are you still with us?
Yes, I'm here. The first question you said, which is the...
Yes, the most effective communication method. And the second one says, is there no solution for language barrier?
Okay. Let me start with the second question. It's same as I said, that in that speech difficulty, and you have to employ the services of someone that understands vividly what those people will communicate to you. You have to employ the services so in order to breach that language barrier. The second one says, which is the most effective between the verbal, written, and then the unwritten one? I wouldn't say that verbal is the most or the written is the most, because if you say written, There are people that cannot read or write. Do you understand? So I believe the three will have to be working in pari passu, yes. So if that these people do not really understand what you are saying in words, you put it down in writing for them, they can understand it, or you put it out in media, the unwritten words for them. You show them through pictures, through videos, they will understand what you are saying. So I wouldn't say one has to be chosen over the other. I would say the three has to work in cognizance. Thank you.
Okay, thank you very much. Thank you so much for the answers. To add a little to this question, the first one. So there is no most effective method, like she said. You as the presenter or the communicator, we have to choose the method that you consider effective, given the context. Communication takes place in a context. So given the context in which you are giving your information, you choose what is most appropriate. If you want to talk, if you want to communicate and you need immediate feedback, you may consider oral communication or verbal communication. Okay. So, but in some other context, you may consider written communication so that somebody can go back and refer to what you have said over and over again. So it depends on the context. The context determines which one will be more effective and which one will be less effective. More often than not, we do not use one particular method. Most times when we communicate, we use a combination of all the various methods. So I hope your questions have been answered. Thank you so much for joining us. Thank you, all of you, for joining us for today's Oraposium. Thank you, the presenter, for the job well done. The comment session will still be open for comments and questions, and the conversation goes on and on. Join us again by this time in a fortnight when we'll be having another wonderful presentation from another member of the college. Thank you so much for joining us, and see you next time. Bye.
Bye.